Mike Grafinger here with Triangle Veterinary Referral Hospital. I'm the Chief of Surgery. Today I thought I would go over ways to kind of biopsy or do a final aspirate of a mass. A lot of times we feel lumps and bumps on our animals. Most of the time, fortunately, they're benign. They're fatty little lipomas or fatty little tumors. But sometimes they can be something that's more aggressive. And initially, there's two different ways you can do it. The first step that I recommend doing is doing a final aspirate, where you actually take a needle, and you can see the tip of the needle is very small, and the opening of the needle is very small. And you stick that into the mass, and then you aspirate and you pull cells. And then what you do is you squirt those cells onto a slide, and it's a very minimally invasive way to diagnose what a tumor may be or a mass may be. Sometimes that's not enough, because some masses, they do not really exfoliate or shed cells. So when you stick the needle into it, it doesn't really pull out the appropriate cells to tell what kind of mass it is. So in those cases, I usually recommend doing a biopsy. And with a biopsy, the most common thing that you can use is what's called a punch biopsy. So essentially it's a round razor blade. You can see it's round, it's sharp on the edge, and it takes anywhere from 2 millimeters to 8 millimeters to 10 millimeter punches. You stick that in the tissue, and it goes all the way through the skin and the mass and takes the sample out. And the benefit of that is that actually gives you a really good picture of your mass, because it's all the tissue. It's not a small, not even a millimeter wide sample. It's a very large sample, and it's tissue. And that can be sent off for a histopathologist to review and tell you exactly what you're doing. The benefit of either of these, doing this before removing a mass, is that you're doing it to know your enemy. So knowing your enemy is very beneficial, so you know how much tissue you should take off, how aggressive you need to be to remove that mass. A very common mass that we see is mast cell tumors. Mast cell tumors are very common skin tumors in dogs, but if they're not removed, they can actually end the life of the dog. They can be very malignant and spread very quickly and kill the dog. And most of the time, you can diagnose a mast cell tumor with this. You just kind of stick a needle into it, you squirt it onto a slide, and there's certain cells, mast cells, that you'll see. In other cases where you have sarcomas, this sometimes does not work so well. It's a different kind of tumor. And you use this type of biopsy. When you use that type of biopsy, it can give you an idea of what kind of sarcoma it is and how aggressive you need to be. So it's always a good idea to get a sample. Go to your vet if you find a lump or bump. Go to your vet initially and have them do one of these simple diagnostics. And then potentially, depending on how large and big the mass is, refer the dog to me or cat to remove the mass. It becomes very complicated. Unfortunately, most are not. It can be removed by your general practitioner.